Swadikap, good evening once again. Friday, the 18th of March, 2022, and this is the English language summary of the press briefing here at the Center for COVID Situation Administration, or CCSA. Dr. Thuisin just now mentioned many important issues. Of course, today we had the General CCSA meeting, which was chaired by the Director of the CCSA, or the Prime Minister. And important issues included the measures that we'll be having in preparation for the Songkran festival. So first of all, Dr. Thuisin recapped certain issues, the important issues, such as the timeline in which we will be phasing each phase of the situation in Thailand from now onwards. So from now until the beginning of April, we'll be calling this phase the combating phase, of course, because April, as you know, we'll be having the Songkran festival. And in the past 1 and 2 years, the Songkran festival had posed as a risk for the spread of COVID. So from now until the early part of April, we'll be calling this the combating stage. From April and May, we hope that we will be seeing a plateau stage. A plateau stage meaning that the numbers will not be increasing, we will remain in the same level, like a plateau. And towards the end of May until the end of June, for 2 months, we hope that this will be the declining stage for the COVID situation in the country. From the 1st of July onwards, hopefully, if all goes well, if the numbers and situation goes as planned, we hope that we will be transitioning into an endemic, from a pandemic into an endemic, or what we would call the post-pandemic stage. So that's the plan and timeline, hopefully. Of course, all of this has to require the good management and cooperation by all sectors of society. Just 3 important points. One is that what has to be done, of course, is that the treatment has to be swift and accessible to everyone, so that the fatality rate by that time would remain lower than 0.1%. And number 2, of course, is that the booster vaccines should be more than 60% of the population, and of course, a higher percentage for the elderly group. And thirdly, of course, building awareness and proper understanding and cooperation from all sectors of society in this adaptation and in receiving and in mitigating the impacts of the pandemic, so that we will be able to live with COVID-19 as an endemic from the 1st of July onwards, hopefully. Of course, the management would require different aspects, the public health aspect, of course, the legal and social aspect, the medical aspect of it, as well as the communication and public relations aspect of it. So in summary, Dr. Thuisin outlined this in the Thai language version, which actually takes us forward around 4 months, around 3 or 4 months ahead, so that hopefully we will be transitioning into an endemic in Thailand. So just in addition, I'd just like to mention that from the meeting this morning at the General CCSA meeting, the meeting resolved to extend the emergency decree to contain the spread of COVID for 2 more months. That is from the 1st of April until the 31st of May 2022. The meeting this morning also redesigned the COVID control zones starting from the 18th of March, tomorrow, that there are 20 provinces in the controlled area now, in orange zone, and you will see a screen, infographic on screen for you. There are 20 provinces in the controlled or orange zone, 47 provinces in close surveillance or yellow zone, and 10 provinces categorized as the tourism pilot blue zone. And you have the number of provinces on the screen and the list of provinces as well. So as you can notice, a few months ago we had dark red and red. So we've shifted that designation already and redesigned that to have orange control, and then yellow high surveillance, and then of course the pilot tourism sandbox in blue as usual. For the orange zone, some of the measures would be including activities gathering than less than 500 people are allowed. Schools can open under COVID-19 prevention measures. Exhibition and convention centers allowed to open for less than 1,000 people. The restaurants open until 2300 hours, but no alcohol allowed. Spas and massage parlors, barbers, beauty clinics, and tattoo parlors are allowed to open until midnight. So just as a recap for the orange or controlled zone, the highest color-coded zone that we have right now. For the yellow zone, as you can see on screen, the majority, a lot of provinces are in that, 47 to be exact, provinces. In that group, activities with gatherings and less than 1,000 people are allowed. Exhibitions, and of course in spas and barbers, beauty clinics open as usual, while restaurants can open as usual with alcohol being served in venues allowed until 2300 hours. For the blue zone, particularly for restaurants, can open as usual with alcohol in venues allowed until 2300 hours. Let's turn now to the usual update on the entry into Thailand. Up until yesterday, from the 1st of March until the 17th of March, you can see on screen over 142,000 travelers entering Thailand in the month of March alone to date. And of this number, over 125 through the test and go or quarantine exemption scheme. We have over 14,000, almost 15,000 through the sandbox scheme, and over 2,000 travelers entering through the alternative quarantine system. The majority of the travelers come from these top 10 countries from the 1st of March to the 17th of March. We have Singapore, Germany, the UK, US, France, UAE, and other countries as you see on screen right now. So this is particularly for the month of March to date. So we're over half of the month of March already. Domestic situation, numbers we have for today. New confirmed case, a little over 27,000, so 27,071. We have new recoveries tailing behind at 21,522. And unfortunately, as you see on the red box on the right on screen, 80 cases of fatalities, of deaths recorded for today. More infections with severe symptoms were found in the northern provinces and northeastern provinces of Thailand, such as in Chiang Mai, Roi Et, and Buriram. So that's where most of the severe symptoms have been found recently. And many infections are those from close contact with infected family members and friends as usual. And clusters also found in these provinces in restaurants, factories, offices, and open markets. For the top 10 provinces that we have on screen there, yes, for you right now. So as usual, you see the list. Bangkok still tops the list, of course, the metropolitan area of Bangkok, the capital city, with over 3,200 cases, green being more than the previous day. Well, it's a list, but we hope that, of course, provinces would not want to be on this list every time that we have this briefing. You can see today that actually there are more red than green, which is actually not so good news because it's more than the previous day. So I'll move to the vaccination progress in our vaccination drive. So on screen we have today, well, the numbers are as of yesterday, 1800 hours, administering more than 186,000 doses. The total cumulative for the whole country now stands at 126 million doses already. That is over 78% for the first dose, 72% for the second dose, and 31% for the booster dose, as you see the numbers on screen. And as I mentioned in the beginning, of course, one of our criteria in order to move to an endemic stage of COVID, as compared to the pandemic, is to have over 60 or 70% of inoculations for the booster dose in the country. So now we're standing at 30%, and we have a few months left. I believe that this will be achievable. considering, of course, the vaccine supply and the capacity of our medical personnel. Dr. Thuy Sin also mentioned about measures for travelers entering Thailand, but before that he mentioned about measures abroad as well, because many countries around the world have been adjusting their measures. Some do not require quarantine anymore. Of course, you would have to check each particular detail for each country. But for inbound, for travelers entering Thailand, the General CCSA meeting today agreed to adjust measures for travelers entering through the Test and Go Sandbox and Quarantine scheme. So firstly, it is being considered that the RTPCR test prior to arrival will not be required anymore. That's being considered according to these discussions in the general meeting today. And when there's a confirmation and when there's an actual release on that, we'll let you know as soon as possible, but closer to that already, of course. And of course, from the 1st of April 2022, for those entering Thailand through the quarantine scheme, will be required to quarantine for only 5 days, vaccinated or unvaccinated. So this actually is a reduction of the number of quarantine days, 7 and 10 for those vaccinated or unvaccinated, and then those who do not reach the requirements. Of course, now it will only be 5 days if it requires any quarantine. Of course, Test and Go would not require that quarantine. So just to remind you of the latest measures for travelers entering through all the schemes, that after arrival, travelers will be required to undergo the RT-PCR test on day 0 and self-ATK on day 5. This is upon arrival. And the minimum coverage for COVID treatment on the travel insurance policy is at $20,000 US. Thai nationals and returning expatriates are exempt from this requirement. I mentioned about the measures that were discussed during the General CCSA meeting for the Songkran festival in the middle of April, next month already. Time flies. So we'll have on screen for you some measures there. So since this festival, the important festival, is coming up, the meeting discussed various measures to reduce the risk of infection. Very, very important that the elderly, in Thailand during Songkran, people often return to the provinces and of course visit their parents and the elderly. That poses actually as a risk. That's why we have always been talking about the booster dose for the elderly is very important before the Songkran festival in particular as well. I know that many foreign expats, of course, with Thai families, you also accompany your family to go to the provinces during Songkran. So that's really relevant for this audience today. So water splashing, usually a tradition in Songkran and other traditional activities, such as Rot Nam Dam Hua, paying respects to the elderly by pouring holy water on their hands, are allowed to be held, but in line with the COVID-free setting measures. While, of course, the more non-traditional, the more contemporary kind of party celebration, like foam parties or selling and drinking of alcohols in venues are not allowed. Those who attend Songkran festival in closed spaces must wear masks and maintain social distancing at all times. And of course, water splashing has to be under the COVID-free setting as mentioned, and not in public areas such as roads. So with that, I thank you very much for your attention. I wish you the best of the weekend, and of course the week ahead we'll be continuing with the briefing that we have leading towards the month of April, which will be having Songkran. As you know, a lot of the measures will be adjusted from the month of April onwards. And the note that I would like to highlight, of course, is middle of April. Very important to be very, very careful for Songkran festival. Whether you live in Thailand or you are visiting Thailand, it's a very important festival. A lot of gatherings of people usually. But of course, this year we have to be very, very careful. So looking ahead to the 1st of April for some new measures, middle of April for Songkran, And of course, as we lead towards the endemic, as we move towards an endemic phase, transitioning from the pandemic to an endemic, I hope that we'll see better days ahead, leading to around the month of July, hopefully, with all your good cooperation from all sectors of society, Thai and foreign alike. So with that, thank you very much for your attention, and we'll see you again next week. สวัสดีครับ
ครับขอบพระคุณนะครับท่าน